Serum Institute CEO Adar Poonawalla says that the government will announce COVID booster policy for all in the next few days. He says that they've appealed to the government over the boosters being available to all because anybody who travels would need a booster dose, and is hopeful that the policy will be announced soon by the government. Also says that discussions are currently on within the government. Let's listen in.
Booster dose. We have appealed to the government for a few months because, everyone who needs to travel needs to take the booster dose, and they're having internal discussions and should announce very soon in the next few days on the booster policy, because all other countries are doing it, and now it is time for us also to look at it, because the central government has done a fantastic job. Modi ji's government has covered almost all the entire adult population with 2 doses. अभी बूस्टर की भी का समय आया है, तो हमने अपील किया है, अभी डिसाइड कर लेंगे.
All right, we've got Dr. Rajib Dasgupta who's joining us here on the broadcast. Thank you very much, Dr. Dasgupta, for joining us on Mirror Now. Your reaction, because obviously booster doses, opening it up for all, has been a major discussion point for some time now, and there is still no clarity. In your opinion, is this something now that should be done sooner rather than later?
Hello, good evening. Yes, it's true that India has done incredibly well in the coverage of the primary schedule of 2 vaccines. We also have got several vaccines in our city, plus the fact that we have got a comfortable stock. What is critical to understand is that there are 2 kinds of requirements that needs to guide the policy here on about boosters. One, of course, is international health requirements. Now, generally what happens is that our vaccines, let's say yellow fever vaccine, the WHO has a specified schedule that holds across the world for the relevant countries. But here we have different countries actually, practicing somewhat different regulations and regimens. So one, at the global level, WHO ought to consider bringing in a uniform policy across the world, across its member states. Second, India will need to cater to the travel requirements internationally. And third, the vaccine policy would also be guided by the continuing emergence of new strains and recombinant strains such as the XE now.
Right. Absolutely, Dr. Dasgupta. And in terms of, at this point in time, your perspective on should it be the sooner the better as far as booster doses are concerned? Because obviously India is one of the few countries where boosters are not available for all at this point in time. Given the supply also of vaccines, which is not an issue at all, this would perhaps be the right time to go ahead and open it up.
The policy would be or is likely to be shaped by 2 or 3 things. One, what the recommendation would be for the vulnerable, and that ought to include vulnerable among the young also. For example, those on cancer therapy or kidney disease with immune compromised status, etc. Second, would it be across the board for adults? And third, as we were discussing earlier, what would be the modalities? Will it be available across the board? One would still have to go through COVID. Now, these are both policy as well as operational issues. I'm sure the NTAGI would take a view on all of these, and the NTAGI's advisory, along with the ministry's operational strategies, should bring clarity in a few days.
All right, Dr. Dasgupta, thank you so much for joining us with your perspective.